Hello, good evening, and Happy New Year. My name is Tal. I'm the Educational Director at the American Academy of Functional Health. And with us, we have Dr. Esha.
Hi, everyone.
And we want to welcome you to the Functional Solution podcast and class. This is where we are diving deeper into the root causes and the epigenetic factors that contribute to your patient's chronic conditions and chronic symptoms. And as usual, we also discuss what is the science behind functional and integrative medicine, what is the clinical application. So if you're looking for additional strategies or to offer comprehensive care to your patients, you're in the right place. And I feel like today we have a very unique topic, Dr. Esha, right?
Yeah, totally. I think this is one that a lot of people will benefit from because we always have these kind of questions in the coaching sessions as well, like how to kind of look at this information and interpret it.
Yes. And as we dive every week into certain topic, a certain condition or a symptom, to better understand how we can serve our clients or community, this week we wanted to do something a little bit different, which is talk about one of the most comprehensive lab tests that are available, which is Metabolomix Plus. And one of the ways that I'm thinking about Metabolomix Plus is if you only have opportunity to do one test in your practice, maybe because of finances or whatever it is, Metabolomix Plus is, in many cases, would probably be the go-to. That's the way that I think about it because it's so comprehensive. It gives you so many data points. And it's really one of the most comprehensive functional assessment availables. And the nice thing about it is that it does not require a blood draw. This is something that you can drop ship this lab kit to the patient. It's a urine sample, and it gives you such a variety of indicators from cellular function, nutrient deficiencies, oxidative stress, mitochondrial health, detoxification capacity, methylation, neurotransmitter balance, fatty acid metabolism. It's great for so many different conditions or symptoms that your patients might be experiencing with. So this is a lab relatively new, but we're seeing this for patients that this might be really useful for patients with chronic fatigue, low energy, brain fog, mood changes, because it also has neurotransmitters, indicators that can imply imbalances in neurotransmitters such as serotonin. If they have metabolic challenges such as diabetes type 2 or weight gain, and of course, if they have complex or multi-system symptoms and you're trying to figure it out and narrow it down to what are the one or two things that are most important. Dr. Esha, what does Metabolomix Plus means to you? What kind of in general, the general impression?
Yeah, I think it's a great test to use when you're trying to get an overall snapshot of what's happening with your patients. And it's not just a snapshot. It's pretty detail oriented, but I think it's a really great starting point. So if you're not sure sometimes like where to start, you have a really complex case or maybe not so much a complex case. This is one test that I think covers a lot of bases. And so it gives you a landing point as a practitioner to know how to work this case up, and how to also show your patients that there are objective data points that match their symptom picture too, and like what they're experiencing. So I think it helps just to affirm your patient where they are and give them a peace of mind that yes, something is actually happening. Because a lot of the patients we see are coming to us because they're not getting results elsewhere. So this is a nice way to find some results. And then I think it's a good place for us as practitioners to kind of start with basic protocols, and we have evidence to support why we're doing those protocols. So I think it's a really nice test. That test has been around for a while, and I think Genova is a really great company for some of these like overview pictures for your patients.
Yeah, absolutely. And I really appreciate your feedback, because I know that you have over a decade of
Yeah.
as a functional medicine practitioner, and not just doing functional medicine, but also years of experience
Hmm.
coaching, mentoring
Yeah.
other healthcare practitioners. So that this is going to be a really great class to dive deeper and understand the lab. And by the end of this class, you will already understand this lab. What are some of the important biomarkers? What should you be looking for? And how is this used as a functional tool? So with that being said, let's dive into first, what are the key benefits for this particular lab? It's one of the most comprehensive lab assessments that is available. It, as mentioned, um, integrates a view of multiple systems, such as our gut, our neurotransmitter, our detoxification, environmental factors, nutritional deficiencies, cellular function, utilization of glucose or fats. So it is such a comprehensive tool. And as Dr. Esham mentioned, it helps us to prioritize what are the top 2 or 3 factors that we would want to focus on that will give us the biggest difference in the patient's experience. And of course, excellent for pattern recognition and clinical reasoning. The pros is that it doesn't measure directly the levels of it doesn't measure directly the function of the organs or the systems, because organic acids reflect essentially gives us a indirect how should I call it? Indirect metabolic consequences, right? So it's not a direct measurement; it's an indirect measurement of what is most likely happening in this particular system. But so this is really important to mention, that it does not indicate a localized dysfunction at a specific organ, such as the gut, liver, or brain. And it cannot independently, as a tool, diagnose gut dysbiosis infections or environmental toxin burden or any structural disease, right? So this is more of a tool that is used as an indicator to allow you to investigate further. And for that reason, we always combine the lab results with the patient experience or clinical presentation, right? So we want to match the symptoms or the patient experience with what we're seeing in the lab. Of course, while you're wearing your functional medicine hat, thinking hat, and you understand the mechanisms, of course, that's really important. But it is, the reason we chose this is because really it's the most comprehensive tool that is available, and it gives you so many levels of data and information. And you're going to see that we have pictures for you from a sample of a lab that we have. So, Dr. Esha, with that being said, take us into what is the overview of the lab? What does it look like? And how would they use it? How would clinicians use these labs? Oh, Dr. Esha, I think you're muted.
Yep, I was. So let's take a look at the very first page. This is like the first page you'll see when the results come back in. And on this page, you see these functional imbalance scores. They're going to help us as practitioners quickly identify which systems are essentially under the highest amount of stress, and then what should be prioritized. Sometimes when you get these tests back, depending on your patient's background, their picture, what's going on, you may have a lot of these sections come back in the red. I wouldn't recommend focusing on all 5 of those sections. I would say you may just pick 2 to focus on at a time as you go through different phases of their protocols, because it's really overwhelming for you as a practitioner to figure it all out and do it all at the same time, kind of throw the kitchen sink at them. And then also it's even more overwhelming for patients to do all the things and try to remember why they're doing all the things. So I would say just focus on 2 areas, and then you can kind of work the other areas in as needed, or in like the second phase of the protocol, however you want to do that, because I have seen that before where all of them will come back red. So in this section, you can see oxidative stress, so that first one on the left, mitochondrial dysfunction, omega imbalance, toxic exposure, methylation imbalance. And like Dr. Tall mentioned, this is not a diagnostic test, but it's just kind of a way to understand what to prioritize clinically for your patients with functional medicine. So in this example specifically, you're going to see that number 8 in the red. So that's letting us know there's a very high need for inflammation. So whenever something goes 8 to 10, it's typically like alert. This is an area that needs to be supported. The rest also kind of show some, like the yellow is more moderate. The green is like there's not really a need for support here. But yellow and red definitely should be kind of targeted and focused on. So in this example, the lab is going to show very high need for inflammation support and a higher need for a reduced toxin exposure. That's that level 7 to the right of that red 8 circle. So this is going to tell us that the dominant drivers of the dysfunction are not isolated nutrient deficiencies, but maybe ongoing inflammatory signaling and exposure, toxin exposure related like metabolic stress. So how we would interpret this, we would say, okay, the inflammation picture is higher. So this may indicate this person has upregulated inflammatory pathways, increased oxidative stress, which is secondary to inflammation. They may have a higher metabolic demand for anti-inflammatory and antioxidant systems. And because of this, they may also have a slower recovery from physiological stress. So when reduced exposure support is high, the toxin exposure piece, this may suggest essentially ongoing exposure to environmental, dietary, or endogenous toxins, or this person may have an increased need for detoxification, a higher reliance on things like glutathione and methylation dependent pathways. So sometimes it's, we're thinking, hey, does this person have an issue with their glutathione picture? What's happening there? Maybe that's what we need to support this detox picture. Maybe there's something directly causing an environmental exposure or uptick in that toxin picture. So there's many ways to think of it. And then also, it could also suggest that the system is compensating, but it's under some strain. And so as practitioners, when you're thinking of kind of your care plan, rather focusing on, only on energy production or, single nutrients, this pattern can help us prioritize that the major kind of themes we want to think about, right? So one, we want to think, hey, this person, we would love to see this 8 come down to maybe a 5 or come down to a 0, right? But we want to see the numbers going down. So we need to reduce those inflammatory triggers. So we're going to talk to them about their diet. What are you eating? Are there bigger dietary inflammatory loads there? Are there a lot of processed foods? Are there a lot of poor quality meats if they're doing those types of things? We're going to talk about lifestyle stressors. What's your lifestyle like? What's your sleep quality like? What's your, interpersonal relationships like? What are the bigger stressors for you? We want to talk about, sleep is a really big one too, for kind of a trigger for inflammatory stress, that whole cortisol picture and how that happens. So definitely those are just kind of some simple ways we think about how to start talking about that inflammatory scenario. Where the toxin picture, we're thinking, what could this person be exposed to? So we think about where they live. We think about if they live in a factory town, farming town. We're thinking about the types of produce that they're eating. Are they eating mostly like pesticide-laden products? Could it be their job? Where do they work? Things like that. Those are the basic starting points for those environmental toxin inputs. And then we're thinking about, does this person just have issues with like maybe clearance of the toxin? So were we thinking liver? Are we thinking gut issues? Are we thinking kidney? Are we thinking glutathione, antioxidant systems are just a little rusty, so they need more support with upregulating those so that those organs can, do their jobs? We think, okay, how do we support this person's ability to detox properly without being overly aggressive with our protocols. So we think about supportive strategies that are already aligned with where the patient is at, and just kind of naturally supporting those organs that are already existing in the body. So how do we naturally support liver and help upregulate liver health? But that could be many different ways. How do we upregulate their gut health, right? We think, hey, does this person need some gut antimicrobial support? Do they need some probiotics, things like that? How do we do that with their diet? And then we just kind of sequence the care appropriately, right? So we want to address the inflammation and exposure first, and then after that we can go to whatever else may kind of be highlighting there. So that could be the methylation picture or mitochondrial picture, or if you wanted to, kind of loop them in together, sometimes that's okay, especially for methylation pieces. But I would say I would not do everything at once if all of these come back for your patients. Most of the time that's not the case, but I would say you want to prioritize the things that are more in the red, in the yellow to start. So in other words, this page is going to help us as clinicians answer the question, what is stressing the system the most right now? And then we're going to build a care plan that's going to remove those obstacles before we actually, add support. So that's the first page that you typically see, and that's how you look at it. And then the next page is kind of deep dive into that. So I'll let Dr. Tall kind of jump in to go over some of the other ones. I think you're muted.
First page is really great for the general overview. And then from there, we're going to start going into each section separately. So the next section that we're going to take a look at, and that would be section number 2. This is the nutritional deficiencies and digestive support. And so you can see here in the page, this is where we're not necessarily measuring the dietary intake measurements or serum nutritional level, although there is an add-on to this test, which is a blood sample, which gives you much more in detail the nutritional levels, but they essentially reflect how hard the body is working to maintain metabolic balance and which nutrient appear to be in higher demand for your patient. And so you can see here, for example, you can see there's the green reference range, and then there's also the yellow, which is higher need, and then there's the red, which indicates a much higher need for those. So we typically focus on the ones that are higher demand, which is the on the right scale of the yellow reference range and the red. And you can see here vitamin B1, B2, magnesium, and omega-3 fatty acids, along with high need for digestive support. So as clinicians, it's the best thing you can do is invest in a good training that shows you the indication of the function of each one of those. So when you see those on the labs, they don't just indicate the deficiency of B1 or B2 or magnesium. You now have a deeper understanding of what are those nutrients required for. So let's take a look at an example at a chart that we prepared to better understand these imbalances that this patient has in their lab, and how might these imbalances or deficiencies affect our patient's function and lead to chronic symptoms. So you can see here in the chart, there are multiple different nutrients. So you can see from vitamin B1, which is needed for carbohydrate metabolism and production of energy, ATP. If there is deficiency of B1, then your patients can experience fatigue, brain fog, irritability, right? The function is really in providing efficient glucose utilization under metabolic stress. You have vitamin B2, which increases mitochondrial and antioxidant demand. Again, very similar symptoms. If the mitochondria does not get sufficient nutrients, it cannot oxidize the metabolites of glucose. And it can't produce enough energy, which leads to persistent fatigue. And then it also depends on which organ is impacted. Remember that the mitochondria is highly prevalent in organs that need energy, in high demand of energy, right? So our brain, our heart, our digestion, our muscles, right? So depending on which organs are impacted, that's where you're going to see the symptoms, right? So if it's the brain, mitochondria in the brain, they might experience brain fog, cognitive decline, headaches, poor stress recovery, right? If it's the muscles, they might experience muscle fatigue very quickly, or weakness. Also magnesium, you can see that magnesium is so important for dozens of enzymatic and neuromuscular functions. So if there's high demand for magnesium or deficiency, then they can experience muscle tension, poor sleep, anxiety, or sometimes they can feel wired but tired, right? Which is a kind of a weird experience. Omega-3s are really important for the inflammatory pathways to modulate and have a healthy inflammatory response. If they got joint or muscle pain, inflammatory gut or skin symptoms, that could indicate that they have chronic systemic inflammation. And omega-3s are really important. And of course, digestive support. So if they have reduced digestive capacity, maybe because their pancreatic insufficiency, they simply don't produce enough enzymes. Maybe your patients are on a flight or fight, right? Like so many of us running around in this crazy world with multiple factors that are stressing us out. If our body can't handle it, and if your patient is on a fight or flight mode, they're turning off the secretion of digestion juices and enzymes and everything that's supposed to properly break down their food. So are your patients needing some support with that, right? That's something that is definitely indicated here as an example for this test. So this is really, really useful. And there's like 3 or 4 pages of this information, but I brought you the first one, which gives you the overview of all of those results. Now, the next page is where things really get interesting because we're diving into system-based review and looking at the function of different systems. Dr. Esha, take us into the next section, which is section number 3.
Yeah, totally. So we are going to talk now about cellular function, kind of oxidative stress, mitochondrial health, which are all very important aspects of any inflammatory picture, just our patient's health in general. So let's look at page 7 of the report, which is typically where we find these details. So page 7 is going to map cellular energy production. So it's going to show us how the carbohydrates, the fats, and the protein feed into the mitochondria. So when I talk to patients or go over their reports with them, I'll just kind of try to make it as simple as possible. I'll say, if you have some rice, this is the carb section. This is how it's going to be breaking down. If you're eating a piece of chicken or some beans, this is a protein picture. This is how this is going to be breaking down and feeding into, just to make more sense to them. But essentially, we're looking at this section to look at the citric acid cycle intermediates, fatty acid beta oxidation markers, electron transport chain indicators. These are all mitochondrial aspects. And then oxidative damage markers like your lipid peroxides and your 8-hydroxydeguanine markers as well. So just I know that sounds like really scientific, but just know this is all kind of an insight into mitochondrial health, which you want to know about when patients have chronic illnesses. You want to know what their mitochondrial processes are doing. So the key things to listen for the most part, chronic fatigue for patients with mitochondrial issues, exercise intolerance, right? Post-exertional malaise are things we think about for, is there some kind of mitochondrial imbalance happening here? And then the markers such as lactate, pyruvate, or the TCA intermediates, or could be out of range. So I would definitely say this is a really important page for you to look at and reference, because it also is going to include where the vitamins are important for that particular cycle, and it'll tell you what's happening at the level of that cycle, or that marker, if you will. So the key findings on this page, in this example, we're going to see signs of mitochondrial inefficiency, oxidative stress, and nutrient-dependent enzyme enzymatic bottleneck. So where things are kind of like stopping up and preventing flow of the rest of the process, right? So the nutritional deficiencies affecting the cellular function. So there's an elevated need for B1 and B2, which are going to be essential cofactors for carbohydrate breakdown and mitochondrial enzymes. There's an increased demand for magnesium, which is very essential for ATP, that cellular energy stabilization and enzymatic activity. And then these deficiencies can slow the citric acid cycle and reduce efficient energy production, so that ATP production. And so you'll see the little arrows in there where it's kind of telling you where the magnesium, the B1, and the other vitamins or nutrients may be needed to push those pathways, and kind of what's happening and where it's being kind of bottlenecked. So just, may have to take a little deeper dive, but it's all there. So for the heavy metals and toxic interference, this page is also going to kind of reflect how toxic exposures, particularly heavy metals, can interfere with your cellular function. You can see some of those. I think they're in the red bubbles. Maybe this red, is it pink? The red bubbles there. It'll tell you kind of what those heavy metals are and what step of the citric acid cycle they're going to negatively impact. So heavy metals can inhibit your mitochondrial enzymes, disrupt the transport in the electron transport chain, and also just increase reactive oxygen species. So even more oxidative stress for the cells to deal with. This is going to cause more oxidative stress markers and then compromise energy production. So even like low level chronic exposure can act as a metabolic brake, forcing the mitochondria to work harder while producing less energy. So for example, if your patients are consuming lots of, tuna, right, which is a high mercury fish, you may use this page and say, you see, so mercury is a heavy metal and it can impact your energy production through this pathway. Now, it doesn't happen overnight, but if this is something you're doing day to day or multiple times a week, consuming tuna or high mercury things, this is how it impacts your energy production. So you're showing them how lifestyle habits can impact them day to day and in the long run where their mitochondria and energy production is concerned. So just clinical symptom correlation. If your patient's reporting persistent fatigue, exercise intolerance, brain fog, or just poor cognitive endurance, and you see these patterns on page 7 that we're looking at now, this is going to suggest there's impaired mitochondrial throughput, there's increased oxidative burden, and then there are some energy deficits that are driven by both lack of nutrients, maybe they're lacking the magnesium or the B vitamins, and it could also be due to toxic interference like mercury or lead, things of that nature. So clinical takeaway from this page, it's a lot of information. It's a really busy page. It just simply is going to help explain what's happening with their energy production and why it may be failing. This is a really popular page, especially for our patients with energy issues, which is most of our patients I feel like have chronic fatigue issues. When your mitochondrial enzymes are lacking cofactors and are also inhibited by metals or toxins, the systems just don't respond the same. And so from a clinical perspective, this is going to reinforce the need to reduce those metabolic stressors and then support the foundational cellular function before expecting these like huge sustained improvements in your patient's energy. So this is a really important page to think about. And then there's other information we want to talk about as well. So, yeah.
Yes. Thank you so much for covering that, because
Totally.
Dr. Esha, because I know that is such an important view of what's going on inside our cells, which can impact the organs, the systems.
Right, yeah.
And one thing that we talk a lot about in the cellular function, mitochondrial function, is how a dysfunction not just reduce the amount of energy produced for the cell, but also it could lead to elevated free radicals,
That's right, yeah.
and then oxidative stress, a state of oxidative stress, which can lead to more inflammation, lead to cellular damage. And of course, we go into the accelerated aging part of it, which is senescent cells and how it relates to cancer and autoimmune conditions. So this is a fascinating topic. We're obviously limited on time, so we couldn't dive into much more in depth into these. But you can all log into the functional medicine platform, where you're going to learn about this topic from different aspects of nutrition, environmental, oxidative stress, and how you can optimize the function of these pathways. So that's really cool. Let's go in. With that being said, let's go into the next page. This is where we're going to talk about organic acids and functional systems. So this is page 8 and 9. We're going to show you a picture of what that looks like, so you have a visual right in front of you. We love using visuals because it really helps us to focus on what it is that we would want to address. And you can see here, this is really a part of the core of the Metabolomix report. And you can see which system might be impacted the most and where you want to focus your time, effort, and the patients you want to focus on their finances and supplements or nutritional dietary changes the most. So let's take a look at these. We can see here, this is the kind of breakdown. You can see on the top left, I know there's a lot of data here, but we're going to try and break it down. The top left, you can see malabsorption and dysbiosis. This is going to be mostly focused on the gut. And so when we look at the gut, we can see that the key biomarker here that is marked as there's multiple different biomarkers here, but one of those that is marked off is the DHPPA. Now, of course, there are multiple biomarkers here. We're not going to address all of them because then we'll be here for a few hours. And so, as a note, just note that the key biomarker, and this is something that the labs don't typically tell you, but the key biomarker here is D-arabinitol. This is one of the key biomarkers, which is a yeast-derived organic acid used as a marker of fungal overgrowth and carbohydrate fermentation. So that's one of them. The one that we're going to talk about is the DHPPA, which in this lab, you can see it is elevated. This is the third biomarker right under dysbiosis marker from the top. And you can see that it's in the red range. And so what does it actually mean? It means it reflects an increase of bacterial fermentation in the gut, which is commonly associated with intestinal dysbiosis and impaired nutritional absorption. So when it's elevated, it means it could indicate a gut microbial that is alternation. We could refer to it as an indication, indirect indication for dysbiosis, meaning that there's overgrowth of certain bacteria because there's over-fermentation. There's also increased fermentation of amino acids and polyphenols and reduced efficiency of the nutrients absorption. Your patient might struggle with bloating or gas, brain fog. We dive more into that when we talk about the gut-brain axis. Food sensitivities that can also cause fatigue or bloating after meals, because remember, those bacteria could ferment in excess and cause a lot of discomfort for the patients. Now, the second imbalance we're seeing is under impaired energy metabolism. So this is going to be cellular energy and mitochondrial marker. And this is succinic acid, which you can see it's very low here in this test, which indicates reduced citric acid and impaired mitochondrial ATP. So again, if you don't produce sufficient amount of ATP, what could happen is persistent fatigue, exercise intolerance. So the patient feels tired, or they're trying to lose weight. They go to exercise. They feel exhausted afterwards. They might have some muscle weakness and post exercise extreme fatigue that could occur. It also sometimes reflects mitochondrial inhibition rather than lack of caloric intake, which means that your patient can struggle with excess weight and they're not eating excess calories. It's not caused by excess calories. It could be caused by cellular dysfunction, right? So they're not properly oxidizing those metabolites and producing energy as they should. The next one we're going to look into is to the vitamin B dependent methylation stress. You can see methylamalonic acid, MMA, and that is elevated. So that's something that is also very important to address. And this is one of these biomarkers that is really important for the function of vitamin B12. So on a cellular level, when methylmalonic acid is elevated, it could reflect the functional insufficiency of B12 at a cellular level, even when serum levels of B12 appear to be adequate. And this is a really great example for how functional medicine looks at the whole picture rather than doing a simplified blood test, which is most commonly used in the standard of care or primary care. Just because you ran a blood test and you saw that B12 is normal or zinc is normal or whatever it is normal, whatever nutrient is normal, doesn't mean that it's normal and functionally available at a cellular level. There are actually interesting studies that are published that show that patients under infection had serum levels of zinc that were normal, but when they tested intracellular through the lymphocytes, inside the lymphocytes, they showed that there is a deficient of zinc, right? Because it was overutilized due to the infection. So, and that's one of the reasons why we're seeing studies that have COVID patients and they give them excess amounts of zinc and beyond the physiological daily requirement, and they have the groups that get that supplement with zinc during COVID infection, they have better outcomes, less complications, lower mortality rates. That's because looking at the cellular level gives us much more data about the functional availability and utilization in comparison to the standard of care, which just looks at these levels in the serum. So there's obviously a lot more data here, but we wanted to give you overall an overview, and always look at what are the biomarkers that I'm seeing imbalance, how does that correlate to my patient's symptoms, and write down the top 2 or 3 factors that you would want to address with this patient. And from there, use the clinical guides or the practitioner protocol app that we give you when you're in the functional medicine program, when you enroll in the functional medicine program, and gets you all the treatment protocols right away, right? Dr. Eshad, I know there's a lot of data here, but we want to make sure that we also cover the next section, which is the amino acid and protein metabolism. So take us into it.
Yeah, there's definitely a lot of data, but it's really, really useful. So I think this is one of the best tests we can use for our functional medicine clients. Okay, so let's talk about page 10, which is going to be the amino acids and protein metabolism. So this page is going to reflect like protein digestion, absorption, utilization, as well as downstream metabolic detoxification demands. So in this report on this page, we see several amino acids in the top left are out of range, pointed to impaired protein metabolism, increased stress demand, and then also altered methylation and membrane turnover, cellular membrane turnover. So the 3 most important amino acids to address would be our taurine, which is what we see as on the lower end, and then we're going to talk about taurine, we're going to talk about isoleucine, then we're going to talk about sarcosine, which is elevated. So the taurine is going to be a high priority. Why? Because low taurine can affect multiple systems at once. It can affect your bile acid conjugation. So that's, the breakdown of fats and absorption of fats, and then also thinking of fat-soluble vitamins, right? So if the patient's vitamin D, things like that. So that can give us insights there. This taurine also is going to impact antioxidants and your mitochondrial protection. It's going to impact the nervous system and how we regulate stress, and then also a patient's cardiometabolic stability. So because this patient's already showing in this section this digestive dysfunction, we've seen the mitochondrial inefficiency, then we know the inflammation, oxidative stress, we know that low taurine can amplify all of those problems simultaneously. So the clinical takeaway we would think is if this taurine is not addressed, improvements in digestion and energy and detoxification may be really limited for this patient. So that's taurine. Now let's talk about isoleucine, which is low. This is one we're thinking of for energy and their recovery. So why does this one matter? So isoleucine is a branched chain amino acid, which is really critical for muscle and mitochondrial energy metabolism. It's important for glucose utilization, how our body is using glucose. It's important for mental and physical stamina. So in the context of like the low succinic acid that we saw previous pages on that big kind of circular citric acid cycle and things of that nature, we're thinking, and then also this person may have fatigue and exercise intolerance. We're thinking how low isoleucine is going to directly contribute to poor energy production and slow recovery. So what we think clinically, we're thinking, hey, this may be an amino acid that's reinforcing why this person's mitochondria is underperforming, and then explaining why they're persistently having fatigue or they're persistently fatigued, even if they're getting enough nutrition in, right? So we may think of this picture for isoleucine for that. And then the last one we're going to talk about is their sarcosine, which we think of for methylation. So sarcosine elevation, why does this matter? So elevated sarcosine is going to reflect an increased demand on folate and B12 dependent methylation. It's going to impair carbon metabolism, and then also it can reflect like higher neurotransmitter and detoxification stress. So this is going to align with like an elevated methylmalonic acid. So that's that B12 picture that Dr. Tall was just talking about. It's going to align with cognitive mood symptoms, and then also just poor stress tolerance. So, we want to think about why they're low, and you want to think about what happens when they're elevated. So if the sarcosine remains elevated in your patient, for example, we're thinking of methylation dependent processes like your neurotransmitters, detox, hormone metabolism, and how these might continue to remain inefficient. And then a couple of secondary, amino acids, arginine and ethanolamine. When arginine is low, it's important, but it also improves once our gut function, inflammation, and mitochondrial efficiency improve. So some of these will improve as you're working on other aspects as well. And then ethanolamine, when elevated, can reflect membrane and gut turnover, but is usually a downstream of dysbiosis and inflammation rather than like a primary driver, right? So sometimes working on other systems can improve some of these amino acid pictures. And then other times you want to focus on the amino acids individually to kind of drive some of these metabolic processes. So overall, we want to address the taurine first. We want to support energy amino acids second, and then we want to stabilize methylation demand third. And so that's how we would just kind of view that amino acid section in this amino acid section here. So I'll pass it back to Dr. Tall.
Thank you, Dr. Esha.
Yeah.
And I know that probably some of the practitioners that are watching this class today are thinking to themselves, "Wow, there's so much data in this in this lab test that it could feel overwhelming at some point." But I would probably say, just take whatever you can from our class today, and even if you just put it kind of in the back of your head for later, that's also still okay. What we mostly wanted to achieve today is show you a lab test that is very comprehensive, and as like a one lab that contains multiple data points and multiple triggers and contributors, which is great when you're offering comprehensive care. You want to show your patients what are the imbalances, what's not working well. This is a service that nobody else talks about talks about in primary care. And it also has those visuals that helps us to show. And I used to use that a lot, similar to you. I use that a lot to show patients, here's where the imbalance, right? It's like, you can see it, like, this is your cells. We're trying to produce energy, take carbs or fats or whatever it is, trying to oxidize them, burn them, and create energy so you can feel good, you can function good, right? And this is what's happening. These are the sticks in the wheels. There's some environmental factors here. Maybe there's some arsenic or that inhibits this process. Maybe there's lack of nutrients. So now when we recommend them, we create a treatment plan and we say, okay, we're going to go with this amount of omega-3. We're going to go with these B vitamins in higher levels. Maybe we're going to go with this particular supplement or 2 supplements to support detoxification. Now they understand why would they spend their time, effort, and money into working with you. And this is essentially a really powerful tool to build long-term engagement. If you're thinking to yourself, wow, there's a lot going on there, and just know that you don't need to memorize this information. In the functional medicine program, we actually take you step by step. So we have a specific class review on cellular function, and then we go into where each one of those nutrients are playing a role in. And then we go into each one of those processes inside the cells and how you can optimize that. We give you very simple, straightforward, evidence-based protocols that you can use right away without overwhelming your patients. And then we also do case studies with you. And one of the coolest part is that this is really one of the only programs that include mentorship. So use it, like reach out to, in your platform, you can book a coaching call with Dr. Esha, who's bringing years of clinical experience. You also have Dr. Kim, who's a functional medicine nurse practitioner. So we have a team for you, and we are here to support you as you go into expand your clinical practice, build your own practice, or start offering functional medicine. So the best thing that I would recommend is when you see the need for this, or you got a patient that, you're seeing signs and symptoms of possibly multiple systems, this lab, when you get the result, book a call, schedule a call, a coaching call one-on-one with one of our clinical mentors, and share that through our HIPAA compliant portal so we can review it. We can go one-on-one with you and show you exactly what you want to look into. I've went through that mentorship myself, and it was an amazing experience that taught me so much more than what I was seeing in the classes. So with that being said, if you are interested in learning more, log into the platform, book a call with Dr. Esha, watch the specific classes in the modules on the cellular function and those specific lab tests. And of course, I wanted to show you what's included in the Functional Medicine Mastery, which we currently have as a comprehensive package. So you get on-demand 24/7 access to all the classes. In the first 2 to 3 months, we're going to teach you the entire functional medicine system. Then we're going to go into functional labs, integrative medicine protocols, and then we got 12 specialties for you. So if you're thinking about going into autoimmune conditions, specializing in women's health, hormones, maybe functional or integrative approach to geriatric conditions or autoimmune or cardiovascular or chronic pain, which is very common, we got you covered. We have specific subspecialty classes on each one of those. And again, as I mentioned, this is really the only program out there that offers you all the treatment protocols on your phone for a fast and easy access, all the clinical guide mentorship and subspecialty classes, which other programs do not offer. So we're with you, and we also have practice building classes and mentorship for you. So it's the most comprehensive program, and we're making it super affordable with our scholarships. So reach out to us. We'll post the link in the chat if you're interested in getting more information. And we're doing this because we want 2026 this year to be your best year ever. So with that being said, I want to thank Dr. Esha for taking the time.
Thank you for having me.
Yes, I know that there's so much that Dr. Esha can help you with your the clinical aspect of your practice. She's got years of experience coaching, mentoring other practitioners. And this is something you can tell she's very passionate about.
Yeah, just reach out. I'd love to consult with you guys and go over your cases. It's really enjoyable, and we get a lot out of the session. So totally reach out and set something up with me.
Yes, absolutely. And I also want to thank our media team and Jacob for modulating this and managing these online classes, allowing us to be with you wherever you are. And I also want to thank each one of you for taking the time to develop your skills, offer solutions to your patients, help them improve their health, help them improve their function. And again, you're going to be probably, for many of those chronic patients who jump from one drug to another, jump from one practitioner to another looking for answers, you're probably going to be the only person that they're going to meet that can change the trajectory of their life by offering them solutions that are not offered anywhere else. So if you're passionate about helping patients on a comprehensive level and passionate about helping them improve their health, then we would love to work with you. This is really aligned with our passion and our mission statement. And so check out our programs, connect with our mentors, and thank you again for being out there and serving your community. Have a good evening for now, and we will see you in the next class.
Bye, everyone.